So I'm Michael Meneghini. I'm the Director of Orthopedics and Joint Replacement here at IU Health Saxony Hospital. So we are in the new kinematics Gait Lab. Kinematics is a fancy word for how the knee moves and its normal and abnormal motions. And so we're in this new lab that's been recently constructed where we're going to watch people walk before and after knee replacements. So knee replacement today in 2017 still is performed the way it was with general principles, the way it was 20 years ago. The same sort of alignment principles, the same position of the implants, and the same motions. There have been some subtle improvements, such as making the knee more stable and some subtle positioning improvements, but in general, the same techniques I learned 15 years ago in residency are the same ones that are employed today. And interestingly, we've not really closed that gap in minimizing the 20% of patients that are unhappy. So we have to look at things a little differently. And one of the ways we're going to look at it differently here at Saxony Hospital is to analyze patients' gait. So the working hypothesis, as you state, is to look at both the implant types, the alignment of the knee, and the way we put the implants in, and see if we can change or modify those parameters of knee replacement to better suit the individual patient. So if you and I were walking down the street, we have different gait patterns potentially, and we may need our knee replacements put in just a little bit different so that when we're walking after a knee replacement, we say, wow, this knee feels more like a normal knee to me. Right now the lab is built, it's operational. We are in the final processes of getting what's called the Institutional Review Board approval, which is our ability to enroll patients and have them walk on the treadmill and collect the data. And then we'll immediately start the process of asking our patients which ones would be amenable to doing this for us. Certainly it'll be 15-20 minutes out of their day, probably 3 times over a year. So we're cognizant of that. We'll try and make it as convenient as possible, and we know that some patients will have a greater appetite to help us with research than others. We're very proud to have a robust research program, and it's actually been building and growing over the past 5 years to the point where we have published in relatively prestigious medical journals such as the Journal of Arthroplasty, Journal of Bone and Joint Surgery. We want to take great care of patients, and we do, but we also have another mission, which is through the care of our patients, to make things better for future generations. That's very important to us. One of the key takeaways from a story like this is that you have nation-leading research, innovation, and hip and knee replacement care sitting in Fishers, Indiana. I think that is one of the stories that I think the community needs to be aware of and to hear. We have visitors from all over the world, quite frankly, come to Fishers to learn about how to do hip and knee replacement well. And that's pretty exciting. If you look at the exit where IU Health Saxony is sitting, and you see a conference center being built, you see all these hotels going up, we take a lot of pride in knowing that hopefully we're one of the innovative entities that helps bring patients from all over the world to Fishers to learn. And so I think we're pretty proud of that.